Hi, and welcome to Chapter 9, Turnbull, Jeopardy! Yay! Today, we're going to have a special guest on our show instead of our normal players. We're going to be having Professor and Dr. Jessica Lee. Please give her a warm round of applause.
You won!
It's so nice to have you on the show today.
Thank you.
So, instead of we're going to be playing our normal Jeopardy. The topic that we're going to be covering today is special education with an emphasis on mental retardation. Are you ready to tell us about mental retardation and answer our questions?
I am ready.
Okay.
I am ready.
Are you ready, cohort U1? Okay. We're going to start the game now, and I'm going to introduce the topics first. So for our topics, we have identifying students with mental retardation, evaluating students with mental retardation, designing an appropriate individualized education program, IEPs that we're all attending, and using effective instructional strategies, including assessing students with mental retardation. Assessment is really important, as we know. And those are the categories that we have today. So those are the 5 of them here at the top. And to start our game, we're going to ask Dr. Jessica Lee which question she would like first.
Can I please have identifying for 100?
Yes, you may. For 100. How does Turnbull define students who are diagnosed with mental retardation?
They define it because mental retardation consists of significant limitations in both the intellectual functioning, like memory, and the adaptive behavior, like the ability to conform to the norm, and usually it begins before the age of 18.
That is really cool. You get 100 points for that. Okay. So now, which question would you like?
I'd like identifying for 200, please.
Okay. Identifying for 200 says, what are the 2 major characteristics of mental retardation?
It's the limitations in the intellectual functioning, which is their mental capability for solving problems, paying attention, their memory, as well as the adaptive behavior, which is typical performance in individuals without disabilities, and meeting the expectations.
That is really interesting, Professor Lee. For the next question, 200 points there. Yay. For the next question, what would you like to have?
Identifying for 300, please.
Identifying for $300 says, what are the causes of mental retardation?
The first cause, they believe, is due to timing, referring to the onset of the disability, meaning if the mother does not properly take care of herself during the prenatal stage with vitamins and such, mental defects can occur. The second refers to the type of disability, which is a biomedical factor including genetic disorders and nutrition. Social factors relate to social and family interaction. Behavioral factors include substance abuse and dangerous activities on the mother's part. And educational factors relate to the availability of educational supports.
That is why it is so important for us as teachers in the school system to provide support for the special education. And what question would you like next?
Let's go with evaluating for 100.
Evaluating for 100. says, how do you determine the presence of mental retardation in a child?
There's an evaluation process which includes observation, screening, and completing the IDEA, non-discriminatory evaluation process, which includes medical reports from doctors as well as educational reports from teachers and the different levels of the student's intellectual and adaptive skills.
100 points for you. Add to your score. And for the next question.
Evaluating for 200.
Okay. Why do we use the transition planning inventory?
We use this information from standardized tests or scales from the student, parents, teachers to form the basis for the student's IEP and to see which classification of mental retardation the student is.
And now?
Evaluating for 300, please.
Evaluating for 300. This one says define transition services.
This is a toughie. Transition services is when you focus on planning educational services and supports for the students who are moving from one level of education to another, such as from high school to what would be a college or a post-secondary school.
Very cool.
How about designing IEPs for 100?
Okay. For designing an IEP for 100, the question is, who should be at the center of the transition planning process?
Well, the student, of course, because the IDEA requires that the IEP team take into account the student's needs, their preferences, their interests, and having the student attend the meeting or even being the main speaker in the meeting teaches them skills such as setting, decision-making, problem-solving, and enhances their drive to succeed.
I definitely agree with that. Now, next question.
Designing IEPs for 200.
Designing an IEP for 200. This question says,
That was the other one.
describe an appropriate partnership role for a paraprofessional and the student.
Well, providing individualized instruction to groups of students with and without disabilities, facilitating friendships among the students, supporting peer tutors, whether they have disabilities or they don't, using state-of-the-art technology, teaching community settings as well as the classroom, and assisting students with personal care.
All right. Do you know what you want next?
Let's go with designing an IEP for 300.
The last question on the IEP says, to what extent should a functional curriculum be taught to students with mental retardation in a typical community environment rather than in the classroom setting?
Well, when students with mental retardation are unable to generalize skills to typical community settings such as homes, churches, and places of recreation, their instruction should occur in some or all of those settings. Students should improve their intellectual as well as adaptive behaviors in places that are normal but not necessarily learning places.
And do you know what you want next?
How about using effective instructional strategies